All right, let's try this a third time. I'm in a completely different location. And let's see. Let's see if we can. Yes, okay.
Hi guys.
Three's a charm.
Hopefully.
Okay.
Was I clear? Was everyone able to hear the opening part? Should I?
I I heard it fine. I heard
Okay.
it fine, and I think it's my issue, not yours. I'm actually
Okay.
on your island today, and I'm
Oh, welcome.
surprised. I'm surprised that the internet's not been so great to me, but
Well,
that's
it's
okay.
terrible
It's
in
working
Hawaii in
now.
general.
Okay.
Okay,
All
great.
right.
So Yo-Yo
New
Mai says that she
position.
heard it, so or he, they.
Thank you so much for your patience. Okay. So, is it true you have a patient there that you can demonstrate a few things?
No, I don't have one here. One's going to be coming in later just for their treatment, the regular
Oh,
treatment.
nice.
I do
Well,
have an issue that if we want to demonstrate something I could quickly do on myself, but it would be on the leg, not the arm.
yeah.
But I could also discuss and show what I might do in the case of the issues that
Yes.
are related to TFCC.
Yes.
Um,
Yeah.
but before that, what else would you like to cover? We heard about me, why I started the focusing more on sports acupuncture. Do we want to know kind of how that process goes, or?
Yeah, well, what we're seeing a lot of is ECU tendonitis and flexor carpi ulnaris tendonitis and issues of the superficial branch of the radial nerve and the
Mhm.
radial nerve and the ulnar nerve. And most of the cases that I see, it comes down to an imbalance in the function of the flexors and the extensors and impingement at the elbow, shoulder, neck. And so the, in the clinic, you can get somebody into the clinic and you can take care of that. But I'm want to see your perspective on how you manage those issues.
Okay.
Yeah,
Um, so first of all, I would be assessing them and
yeah,
function, checking for the strength of the extensors and flexors, seeing if through manual motor testing we can, like I described earlier, assess whether or not the nervous system is able to adapt to an increase in load. So, for
right.
example, if we're looking to test the extensors, I'm going to have the patient extend a little bit. I'm going to then try to draw down their fist a little bit, and as they resist, I increase. And if they're able to adapt and keep that wrist extending, then we know the extensors aren't at fault for whatever pain they're experiencing, or if they are, it's in a very indirect way, and I wouldn't necessarily address it in that first or second treatment. Um, so that would be the first way I'd go about it. Then we're also talking about TFCC issues. We have the pronator quadratus
Yep.
located over here, which helps us keep our pinky and thumb together. We can test the strength of and function of those tissues with the TNR eminence test. So I would do that as well. Some palpation to find what motor points or motor neurons may be sensitive and tender. Then we would also, you're just correct in saying, then we have it pinched at the elbow. We might have it at the brachial plexus. We might even have it at the nerve root. So I would go through all of the diagnostics on that manually with the patient, um, checking everything I could to make sure we are finding the most active or obvious cause of the
Yeah.
issue and address that first while restoring function to whatever muscles we saw being weak.
Yes. So, if you had a muscle that was not firing efficiently,
Mm-hmm.
so maybe it's not getting feedback from the radial nerve because of a pinch in the neck or somewhere along the structure, how would you go about addressing that?
So yeah, if through assessment I see, oh, you have a radial nerve impingement, so we're talking about the peripheral nerve, what I would do is treat the radial nerve through its superficial portion coming out of here at the elbow. I mean, the light's not important, but we're going to be going in there. And then I'm also going to go into the snuff box, the anatomical snuff box, right there at the thumb, because that's another portion of the radial nerve. We
Yeah.
want to get both portions of the radial nerve in its periphery.
Yeah.
Also, we'd be addressing the brachial plexus by the medial and anterior scalene. It passes through there. So we would put a needle or a pin in that location near the nerve, but not on it. We're not looking to actually hit nerves. We're looking to go near them so we can improve their chemical environment through the effects that the electricity we introduce will encourage from the body, that kind of response. So putting a pin there, there, and there, we would then use electricity at 2 hertz, 2 to 4. It's a low frequency. That's what the nerves respond to. And let that run for about 20 minutes. We'd also be hitting whatever muscles seem to have atrophied because we want to maintain the end organ viability, making sure the muscles that are supposed to do jobs once the nerve recovers are able to do their job.
How long do you generally have to treat somebody that has a nerve dysfunction, I guess would be a good word? And
Yeah.
How long are you seeing, do they need the treatment? Is it 1, 2, 3 times a week, 2, 4,
Great.
6 weeks?
Great question. Yeah. We will see some changes within the first or second treatment generally. And from there, we can kind of determine based on their overall health, based on their health history, how long it would take. I've seen some mostly resolve in 6 treatments, and that would mean twice a week for 3 weeks. So they come consistently twice a week for those first 3 weeks, and we see some major improvements. They may need some maintenance after that, so I might be seeing that patient for about 2 months before we get solid resolution. But even then, I have a couple of cases even right now, a carpal tunnel case, a case with median and radial nerve impingement. It seems they're kind of separate and they're occurring at the same time though. So the more the body has to deal with and manage in trying to tap into its healing potential and then release what substances it has to drive its healing, the more it has to do that, the more difficult and more time it will take.
Yes. Yeah.
But 10 to 12 treatments generally.
And then after, for this period of time that you're doing, you're treating a structure, what's your protocol for activity? Do people rest or they just continue on, or how do you?
Since it is, if we're talking about like a nerve impingement, we're going to have them use the structure and move within all comfortable ranges as often as possible and as much as possible. We're going to be splinting at night. You know, if it's trigger finger, if there's an issue deriving from the wrist or the carpal tunnel, I'll have them nerve floss. So often I will have them go on Google because there are so many different ways people could glide or floss nerves that my patients, they're at work and they want to try it, but they're going to, you know, they're a little hesitant to maybe do some of the movements. So I have them go online and check which would work for them and get a sense of the different things they could do and have them do that. Otherwise, there's not much specific exercise at the beginning when I first start seeing them. It's more just about moving, making sure the blood and lymph is flowing, and that they're using the structures or tissues without avoiding them or being too fearful of using them. That's the first thing.
Now, are you doing any sort of herbal treatments?
Not so much. My training includes herbal medicine, and I would love to be practicing it, and Hawaii would allow me to. But because of how my education ended and the school closing before I finished out my final semester, I actually am not able to sit for that final board. So I sat and passed for 3 of the 4 national board exams, which is, it exceeds Hawaii's requirements, but in my own eyes, wouldn't be proper for me to practice for necessarily. I do have a couple of remedies, herbal remedies, and supplements that I provide to patients and recommend. Most definitely. The yuck gel we made in school, I put on patients quite often. That's a topical herbal liniment. If for people who don't know what yuck gel is. And I saw one of your earlier guests actually mentioned one of the other topicals we have in Chinese medicine. So yes, I still will use those, but less so the internal.
And then in general, what kind of herbal supplements do you recommend for nerve, to support the nervous system?
So there's two things I generally do ask most of my patients to go on, whether or
Yeah.
not it's a nerve issue usually, and that would be lion's mane and NAC. I don't recommend it for
Say
everyone,
it
but if
again.
they ever ask, lion's mane, so the mushroom, which helps reach neurons,
Uh-huh.
and it's good for nerve health. Also NAC, and that is in hopes of reducing the inflammation, whether it be chronic or acute. And there's so many other health benefits to
Yeah.
NAC that
Yeah.
I often recommend anyone that asks about what they could be doing more on. That's one of the first things I recommend.
Yeah. Yeah. All right. So, when do you choose to use electricity versus not using electricity? Or are you always choosing to use
Every time,
electrical current every
almost
time?
every time, yeah. There's going to be some
And
component.
then, uh,
Mhm.
um, what about Moxa?
Oh, I love Moxa. I don't get to use it as much as I would like to, just because even with having a HEPA stage 4 air filter with UVC light, it takes hours to get the smell of Moxa out of the room. And with me,
Yeah,
with
that
as
seems to
busy,
be
busy as
common.
I am and people come in and out, it takes a day and a half usually for that smell to completely dissipate. So only maybe the
Right.
final patient of the day, when I think it could be helpful, will I use it.
Yeah.
But I do love Moxa. We use it at home. We use it for scars. We use it on moles. It's so helpful in so many different issues. It's great. It's a great
Yeah.
thermal therapy.
Yeah. Now, how would you describe the difference between a e-stim unit that is you place on yourself versus using electrical stim
Mm-hmm.
with acupuncture?
Oh, okay. So TENS, like one of the pads that was set on the skin, and then the needle, right? Um,
Yeah.
there's several
Yeah.
differences, which isn't always clear because with both of them, we do get a contraction of the muscles. We see some movement, but even with TENS and EMS, we know already the EMS is going to be stimulating the muscles more. I know you recommend that so that people can rehab muscles after nerve damage. And that is going to be preferable in cases like that, as opposed to TENS, which is more about just kind of modulating pain and
Yeah.
encouraging the body to release, sort of neuropeptides and things like that.
Yeah.
So the difference between either of those modalities and the electrical stimulation that we use with the acupuncture
Yeah.
is there are more chemicals that are going to be released when we go into the belly of the muscle.
Yeah.
The needle itself will release a bit of electrical charge as it inserts and pierces through the skin. So the different layers that that needle goes through is already stimulating the nervous system in a multitude of ways that the pad could not.
Yeah.
And then introducing electricity into the pinpoint area and getting into the tissue itself through research just shows that it has much better, more immediate effects and much more long-term effects as far as regaining function, maintaining function, and overall health. So that would be the main difference. Plus, the response from the brain and the body is just different,
Yeah. Now,
and it's more healing.
one of the things that we see is a inactivation of the triceps and the anconeus and the subscapularis. So they just become kind of uh, they get sleepy. And then we see an overactivation of the biceps, the brachialis, the brachioradialis, the ECU, and the FCU.
Mm-hmm.
So stimulating the tricep with exercise, of course, and using some e-stim and getting that activation strong is a lot easier than slowing down the activation of the ECU and the brachialis and the pronator. How do you do different modalities to calm a tight muscle that's having an adverse pull on the wrist?
Oh, good question. So again, I would go through the assessment and just find whatever is inhibited, whatever muscle is not functioning. And first thing is just to restore that. Often, when that happens, we will see changes in their antagonist and other paired agonist muscles.
Yeah,
So, if we don't see the change from that, then maybe we'll intensify the soft tissue work.
yeah,
Um, if maybe some of the pull is actually coming from tighten the muscle and we're getting pain at the joint because of the pull from the muscle is now yanking on that tendon and you're getting some severe pain in there. If restoring function of that muscle with the use of EA, electrical acupuncture, doesn't
yeah,
work, Then I would sink some needles deep into that tendon and then shallower along the skin up into the other tendon and use a high frequency to stimulate that. That's going to shake the fascia, loosening that up. It's also going to ligaments and tendons, bone, they respond to that higher frequency. It's just going to get a bit more information back to the brain to encourage that whole section now to give.
Yeah.
So that would
Right.
be the next step I would do. If I don't get it with that, then probably gouache and scraping.
Gotcha. Okay, now we're seeing a lot of hamate injuries where the direct for hamate and pisiform. So it's
Mm-hmm.
just usually it's a mechanical blow to that area, and then it's because it's highly innervated, it scars.
I missed the last part after description of it being trauma. So I missed probably the last 20 seconds there, Wendy. Could you summarize the last part real quick? I'm not sure if there was a question or not there.
Okay, so the question, I lost it for a second. The question was, we're getting a lot of blunt traumas to the
Mm-hmm.
pisiform and the hamate. And in those cases, the hamate is a little trickier because it has the nerve and the tendons that glide underneath it. But what they both have in common is a systemic scarring around the bone. As you know, bone heals really fast. It responds very differently to injuries and tendons. But it's that deep scarring around those tiny bones of the wrist that become problematic in getting general pull of the flexors that the tendons that go underneath and near the area. So how would you treat that deep scarring on those small muscles, small structures differently?
So for bone or ligament tendon issues, I would go directly into them. Bone,
Yeah,
the pecking of the bone can improve osteophyte um, activity.
yeah,
We're probably not looking for that if there's scarring, but I would probably try that with some Moxa as well as high frequency. Again, I needle on the bone using a high frequency. That is going to reduce the pain because that helps
yeah,
neuromodulate those kinds of structures,
yeah,
meaning the nervous system will calm down and be less reactive to
yeah,
what should be a very minor touch or movement,
yeah,
something the body
right,
should be able to deal with and adapt to.
yes,
When it can't,
right,
that high frequency in bone helps it. So
yeah,
hopefully what we would see is with a couple of treatments like that, getting the nervous system and the bone in particular to be less responsive or reactive, we would see improvement in the healing potential in that area because we're also driving those neuropeptides, we're driving those responses directly to that location. And
all
I'm getting
right,
a
and
question there. Does it hurt when you do that directly to the bone? No. But what is interesting is I tell patients when I have to peck a bone, when we go through the muscle and the tissues and start touching it, I tell them, it's going to be weird. I don't know how to describe it other than it's going to feel like something's touching your bone. And
yeah,
that's what it feels like. That's it. It's
yeah,
hard to imagine what that is, but it's literally something's touching bone. And
yeah.
I've never felt that, but it's totally okay. It's just weird.
And is the treatment time and length different in that case?
Yeah, yes, it would depend on the tissues and the issues. So for nerve impingement, when we're dealing with a peripheral nerve entrapment or something like that, it's going to be 20 minutes
Yeah,
at least. Um, for the bone, I want to say we go about 10 to 15 at high frequency. I'd actually have to check my notes on that to be specific.
yeah,
But everything we do is, or everything I do at least, is based on what the research shows us. So the
yeah.
frequency, the length of time, are all dependent on the area and all different depending on the
And for somebody that has a distal ulnar sided wrist pain,
area.
how do you gather information about the general health of that person?
Well, I saw you had a guest on earlier who discussed Chinese medicine diagnosis. So I would, if my physical assessment and the XOR system fails to reveal enough for me, I
Yeah,
would then start thinking a little bit more about the issues along the channel itself. So if we're talking about the ulnar side, we're talking about the heart and the
yeah,
small intestine.
Okay.
So I'm going to ask questions that have to do with not just that channel, but that organ.
Yeah.
And within Chinese medicine, we have certain patterns related to each organ. And
Yeah.
the heart channel, there will be different kinds of pathologies that the heart organ will commonly or often experience.
Yeah.
And by asking very specific, very specific questions, sometimes we can start to figure out which of those pathologies under the heart organ umbrella is the
Yeah.
most likely. And then I'm going to dig deeper into that subcategory and find
Yeah.
what some of the lifestyle factors are, some of the general health issues maybe that are underlying and leading to maybe some deficiencies or imbalances or whatever else it is that is causing the symptom. Because whatever the pain is, it's always just a consequence of some other issue, and that's where we're headed towards. We're trying to find always.
So if somebody had an FCU symptoms and
Mm-hmm.
there wasn't any trauma or fall, and you identified that there's maybe something more proximal, more central, more related to the heart, where would you
Mm-hmm.
see some other symptoms on the upper extremity?
Oh, interesting. Where would I see symptoms of the upper? Well, you could find them anywhere along the heart channel.
Which
So
is?
the heart channel coming from the pinky down to the medial forearm, up into the bicep, in the axillary fold. So probably palpating along in there to find out
Yeah.
if there are any more physical things. So we
Yeah.
often will find tenderness along the channel, as that's
Yeah.
referred to.
Yeah.
But because of my training and research, I would first actually start palpating some of the motor points
Yeah.
along that channel. So whatever muscles run along there, I'm going to find a
Yeah.
motor point. I'm going to press in and see if there's some tenderness. If so, we should probably include that in the point prescription because there is
Yeah.
an issue there.
Yeah.
Yeah,
Gotcha.
so we would find tenderness at the motor point, for example, would be another
Oh,
thing to answer your question.
yeah, because I see a lot of people with ulnar side wrist pain that have also symptoms along their small intestine channel.
Yeah.
So the knee, ankle, and it's usually not just the ulnar side of the wrist.
Mm-hmm.
And in those cases, there are injuries. I mean, I'm typically treating young people, young healthy people, and in those cases, it's this small intestine thing, and it gives us clues for that. The heart one, um, uh, I'm not seeing as many little clues in the other extremities, in the knees and the ankle, but you may
Okay.
be seeing that. Are you seeing that?
Um, I've not faced an issue of wrist pain that was ulnar-sided, so I actually
Yeah,
can't say. The wrist issues I get most are going to be those related to the extensions of the flexors. My golfers,
yeah,
my
yeah, right,
tennis
right,
players, right? So,
right,
so
right.
I've never, only recently actually have I heard a patient this last week, a patient who's experiencing some carpal tunnel issue. He says sometimes I'm getting pain at the ulnar nerve. Okay, now we're gonna have to look
Right,
further up this chain. We may have
right,
to, reassess soon. But I
right.
can't say I noticed any sort of clinical trend you're describing. Sorry.
Yeah, yeah. All right. Is there anything else that you can add to this discussion on?
Yeah. Well,
Yeah,
one thing I'd like to say, I prepared some information on dry needling and that topic.
yeah,
Um, and the one thing I wanted to at least hopefully respectfully but emphatically emphasize is that dry needling is just acupuncture. Dry needling
yeah,
is trigger point acupuncture. We have
yeah,
tons of traditional techniques that were taught in school that have been carried on throughout the entire tradition of this medicine as is developed in China, brought to the West and researched more. Um, we've been doing dry needling the entire
yeah,
time. And
yeah,
if anyone is interested in receiving what is referred to as dry needling, please go to a licensed acupuncturist. They
yeah,
go to school, receive thousands of hours of hands-on needling training. We continue education involved with needling. We're not going to a single weekend course getting
yeah,
certified and then throwing needles into people wherever there's pain. The issue with that, beyond the fact that these people who are choosing to practice dry needling outside of their normal scope of practice or getting it kind of grandfathered in through their
Yes.
certification or
Yep.
licensure, one of the major issues is differentiating whether or not the case is chronic systemic or
Yeah.
mechanical.
Yeah.
If there's a mechanical issue, which I would assess through the manual muscle testing we described,
Yeah.
it would be very clear and work on the motor points and dry needling. That kind of stimulus and stimulation is fine. But if we have a patient who's got some underlying issues that, because we're focused on just wanting to dry needling and we don't ask the right questions or pick up on the right signs, the dry needling or a strong stimulation of the motor points is going to cause a flare-up. The nervous
Yeah.
system does not respond kindly to that, and
Yeah.
people who are wanting the benefits of trigger point acupuncture
Yeah.
should go to an acupuncturist, because
Yeah.
dry
I
needling
totally agree.
is just a marketing term that
I totally
allows
agree. Yeah.
people to kind of sneak
Totally
in the
agree.
back door. That was one thing I hope to add to this conversation.
Yeah,
So thank you.
as I'm seeing that, I'm seeing flare-ups with um, dry needling. That's just mm, it does seem in related to weekend courses. Um,
Mm-hmm.
it seems practitioner based. So
Yeah, exactly. And
I'm seeing that.
mm-hmm.
Unfortunately, yeah.
Yeah.
Yeah. Now, how would how would you address meniscus issues, like at the knee? Is there any any different treatment that you do to address meniscus tears?
No, not necessarily, because again,
Yeah.
when we have trauma or injury, there's going to be inhibition of motor function. So our
Yeah.
first goal is always to identify where that is and restore. Because if the
Yeah.
motor function isn't there, the muscles aren't functioning properly, the nervous system's not responding properly, the longer we let that go on, the more neurogenic inflammation, chemicals being released into the tissues and around the nerves,
Yeah.
inflammation will increase and possibly cause further issues. So the first thing would be is assessing that lower extremity. Okay, we know it's a meniscus tear. We're going to address that tissue in a particular
Yeah.
way, but we need to find out what's going on around as well to make sure we're not just uh, uh, throwing water into the ocean.
Yeah. All right. Last question that I have for you is, how do you treat people that have a chronic systemic inflammatory?
Okay.
So
Yeah, great question. Okay,
Crohn's, they
okay,
have,
good. There you go.
they have a
Sorry.
systemic inflammation going on. How do you address that?
Awesome. So it's going to be tailored to each individual. So of course
Yeah.
we'll be going through all of our questions in Chinese medicine and our physical assessments, orthopedic tests, to get a sense of physical and mental and internal health in all those respects. But if it is truly chronic and systemic, with some of the diseases I kind of heard you mention, we wouldn't be able to do the motor point acupuncture. That would be too strong of a stimulus to the body. It wouldn't
Yep.
respond the correct way. So we'd be doing a
Yep.
lot more of the distal points in Chinese medicine. So along the wrist or along the lower arm, same thing with the ankle and leg. The autonomic nervous system responds really well to that because of in those areas we have tons of vessels, blood, and nerves. So those neurovascular bundles respond extremely well. So I would do that, and also perfusion treatment, which is a treatment along the spine. We would, for upper extremity issues, we would be focusing on certain segments of the spine, of that
Yep.
sympathetic chain, and using a low frequency uh, to modulate the sympathetic tone so that the body
Yeah.
has a little bit of inner calm and peace, increasing the blood flow, getting more nutrients to all those tissues, which then helps
Yeah.
them heal. And the calming of the nervous system itself means better sleep, more repair for the next day or two, and some significant and important changes. I actually had two cases,
Yeah.
I'll share with you real quick, two very different and interesting cases that I had to heavily lean on perfusion because I didn't know what to do. One was CRPS, chronic regional pain
Yeah.
syndrome.
Yep.
Younger guy in his 30s was suffering for about 3 years, constant pain. And anytime he tried to increase activity or had a little bit of trauma, things lit up and sparked pain. And
Yeah.
opposite regions of the body, and body parts are changing color, things like that.
Yeah.
A friend referred him, a colleague referred him, so after discussing his case with him, I understood, okay, we really are talking chronic systemic, and I can't
Yeah.
do the normal things. So soft tissue therapy, releasing certain muscles and working with the fascia a bit more, and just doing perfusion treatments. In 6 consistent treatments, twice a week for 3 weeks, the first series of treatments, he received probably about a 60 or 70% reduction in pain. So obviously he was amazed and enthused, came for about 4 or 5 more sessions. He's been pain-free for months. He's surfing again. He's hiking. He's lifting weights. He was able to go back to
Yeah.
school.
Yeah.
All because I was able to differentiate between the mechanical and
Yeah.
chronic systemic. And that's, again, why you can't just say, oh, it hurts here, dry needle, because that poor guy
Yeah.
probably was getting that kind of treatment multiple times from physical therapists, and
Right.
it just sent him backwards over and over.
Right. Yeah. I mean, we have about 20, I would say about 20% of our cases have a systemic issue going on.
Yeah.
And the acupuncture distally, directly is, the outcomes are variable, and when done on the spine and address the central nervous system, it's remarkable, really. It's remarkable on the changes in the skin and the swelling, and it's really remarkable. And
Yeah,
it's
it
a
is
lot
definitely.
faster route to get that treatment and go that route than all of the other things that we're just not finding great outcomes with. So
Yeah, I totally
wow,
agree. And that's the tradition, right? The
yeah,
big pictures, all the distal points, basically,
yeah,
the main points, because we see some changes from the nervous system there. But if we can't, then you got to go to the root, literally and figuratively. Go to the spine,
yeah.
address changes there, because if you're not getting distally, then something
Hey,
major has to be done.
so are you doing, tell me again a little bit more details about the treatment that you're doing in these cases onto the spine.
So perfusion treatment is a treatment off of the spinous process. So it's similar to, but slightly adjusted location from Patojaji point.
Yeah,
So we're going off the spinous process itself, and we're working with the synthetic chains of the upper extremity, the lower extremity, and then the internal organs. So
yeah,
depending on what the issue is, we're going to hit 5 or 4 or 5 different segments of the spine and use low frequency on those for about 20 minutes, 15 to 20 minutes.
now
And
you're doing the needles. Do you ever cross the spine?
oh yeah, there's no issues with that. There
Yeah,
in our textbooks, which are outdated to some
out
extent
there.
on certain aspects of acupuncture,
Yeah,
say don't cross the spine, don't cross this and that, and there's very little research supporting those contraindications or cautions. So yes,
yeah,
I'll have 2 needles. We'll have a set of 5 along the right side of the spine, set of 5 along the other side of the spine. The first segment and the final segment, because those are
yeah,
the way I'm needling, those are the ones that are at the sympathetic chain. So those are
yeah,
the ones that are going to respond best with that low frequency. Those will get crossed across the spine with a single electrode and stimulated. And you can see the stimulation traveling through the other needles as they shake and respond.
yeah, yeah. And you do that for how long?
15 to 20 minutes, depending on the issue.
Okay, so how do you choose cervical versus lumbar?
If it's an upper extremity issue, it's going to be in the upper thoracic. And if
Yep,
it's an issue of the lower extremity, we're going to the lumbar. Well, we're going to
yep,
T10 to L2.
gotcha.
And then if there's other issues, for example, with your knee question,
Yeah,
we would be going probably as well L4, 5, S1,
yeah,
just to get those segments included as well. But may or may not stim them, kind of depends on the patient's age and how open they were to electricity to begin with. I saw some questions here, like from Rhonda, Lisa, saying, I'm scared to have an acupuncturist acupuncture. If they've been trained in it, they're doing it completely safely.
yeah,
There's not going to be an issue. We do it on ourselves when we can as well. So
yeah,
the only danger is going to someone who's not licensed and hasn't been practicing with these modalities, who just
yeah,
went through a weekend course or something, is now gung-ho on stabbing.
yeah. Wow, I really appreciate your time, and I'm really grateful for all of the information. And I know it's going to be helpful to the many people that we see with TFCC problems. Thank you so much.
Well, thank you for inviting me. I look forward to seeing the video up online so I can share that too. So I hope everyone
Yeah,
found this helpful. If you have questions, I'm sure you can ask Wendy
yeah,
or DM Wrist Widget. If you have more questions about
yeah,
electroacupuncture, you want to see me, just DM me on Jack Founderwhite Hawaii on Instagram. I have links in the bio to book an appointment or whatever else. Hope you guys are
yeah.
well.
Super, super. Aloha. Have a nice Sunday.
Thank you guys. Aloha. Bye.
Bye.